Uh, Fortunately, I got professional help and got put on antidepressants, on Zoloft, which is a serotonin-specific reuptake inhibitor, and it's just made a huge difference. You know, I can be kind of myself all year round. It doesn't, I don't have that sort of up and down that I always had before. It's really, it's amazing.
Welcome back. Well, Ed, we had a chance to hear a man's experience of being depressed and sort of the things we've been talking about, and actually his experience with medication, which sounds like it's very positive. In your experience, does medication always work for people?
You know, it's really impressive how good the medications are, and how limited the side effects are these days, but they don't work for everyone. And particularly with something like seasonal affective disorder, you may not want to think of medication as your first line of treatment. And what has been shown to be effective with seasonal affective disorder is light therapy. And of course, you know about that. And
yeah. In fact, we're going to take a look at that more closely.
Okay.
So it turns out that it sounds like for Don, talking as well as medication helped. That it wasn't just a matter of just taking medication, but being able to get some, maybe to address some of those guilt feelings we were talking about before, or...
Yeah, you want to, I mean, I think a lot of times people want the magic pill, and sometimes it is. Sometimes it is simply a biochemical process gone askew, and that kind of rights it and you're off on your merry way. But a lot of times there's other issues going on, other things that need to be addressed, and if nothing else, there are the issues that we were talking about where the family and so forth are being affected, and you may need to address how it's affected your life and how to cope with the disorder. So you need some time to think through how this is affecting you, how it's affecting your family, your friends, and how to come to terms with that in some way or another. That I think is at the very least, an important piece of treatment, in addition to something like medications.
Okay. Well, let's take a look at some of the theories about what causes it, and then we'll talk about treatment approaches. Genetic vulnerability has been mentioned. People with SAD may have reduced retinal light sensitivity in the winter. So someone with SAD may not experience symptoms, in fact, until they experience lack of light. Now, a lot of the research I know I did seemed to be done in British Columbia or over in the British Isles. And then obviously the seasons would, every time I've been there, it's been gray, so I imagine that's probably pretty common. In fact, they were saying as much as 30% of their population really struggles with this. So that lends some credence to this idea about something being different about our ability to absorb light or not absorb light that maybe you wouldn't even know till you moved somewhere.
Right, and yeah, and that can be one of those type of factors that it doesn't stress you until the stressor comes along and you don't know about a vulnerability. And I think it's very likely that the lack of light is a factor. I suspect that human beings developed in a place where there was fairly even lighting throughout the year, and we probably didn't have the didn't develop the biochemical processes needed to adjust our whole biochemistry as well as we might like for those really short winters that you get when you go farther north and thereby get less light. Yeah.
Okay, so in terms of genetic vulnerability, has that been your experience? Have you seen people be in families where, you know, maybe... Certainly, yeah.
Depression and seasonal affective disorder, that the whole category, there is appears to be a genetic vulnerability. It's actually interesting that it's higher in manic depression or bipolar disorder, but depression to some degree. And there are so many factors that it's helpful if you do a history when you're working with someone to see who in their family has had various psychiatric complications, and especially the one you're looking at, like depression or seasonal affective disorder. That can at least give you some clue as to whether this person does have some vulnerability. But you may well also get the person who doesn't seem to have any of that in their family history, and it's there anyway.
Yeah.
Sometimes it just crops up along the way, and it's not an exact science.
Yeah, well, I know that is one of the downsides of our profession, I think, is that it's still fairly new, and often we just don't know what we're doing, but we don't like to tell people that. Okay, let's take a look at another potential cause here, or theory, which is disruption in the biological clock in the brain that regulates hormones, sleep, and mood. So the clock runs slow in the winter, and this is often corrected with bright light, 10,000 lux light box, or a light visor, which has a filter to block ultraviolet rays. So that was a recurrent caution I saw in the literature, is that there have been some studies about people having eye damage who in fact didn't block out ultraviolet rays.
Yeah, and basically there's no indication that the UV rays are helpful in SADS, and so you might as well not have them there. They're dangerous. We know they are. They're the skin cancer
Sure.
promotion
Risk,
and all that
yeah.
sort of thing. So you want to do, when you're doing the light therapy, you do want to make sure you're not doing UV. And for instance, something like a tanning booth probably would not work, mainly because that's UV radiation in the first place. But second, you really want the light in the eyes, and but when you're in a tanning booth, just because of the UV, you're covering your eyes to make sure they don't get it. So you're really not going to treat seasonal affective disorder in a tanning booth. It may make you feel better for some other reason, but not because it's light therapy.
Okay.
And I think probably the biological clock, going back to the theories, that the biological clock theory is probably a good part of the explanation, and that it links into the genetic in the sense that it's these genetically not quite functioning or not functioning through winter type biological clocks that are creating some of the cases of SA.D. Yeah.
In fact, I'm sorry to interrupt you, but in fact, some of it was really linked to our ability to produce melatonin, which I saw, which I thought was very interesting, considering here of late, you know, the kind of the focus on taking melatonin as a way to prolong life and all that sort of thing. So I thought, well, perhaps it may be, in some ways, SADS may be related to like jet lag kind of effects, or I don't know. I don't know about using melatonin, but it seemed to me in the literature that it is one possible option.
Well, it certainly points up the fact that there are things that we do have a diurnal rhythm, and that things like melatonin are some of the chemicals that allow us to go through our sleep-wake cycle, and that yes, indeed, those are going to be implicated in something like seasonal affective disorder, where the sleep-wake cycle is implicated.
Okay. Well, let's take a look at the next one, which probably relates most to our speaker, which was changes in brain chemistry, particularly dopamine or serotonin, create an imbalance. And this can be addressed with antidepressant medication. So again, this is the other theory, which with whatever reason, we tend to have some sort of shift in our brain chemistry. And you know, one of the things that I was struck with in the literature repeatedly is that there seem to be things pointed in this direction, but there still is nothing definitive, which is why, you know, we may want to try more than one thing. You know, you might want to try, it sounds like, getting more light, and you also may want to try medication and that sort of thing. Have you had, in your experience, what makes people usually come into treatment? I mean, do they come into treatment suspecting they have seasonal affective disorder, or do they usually come in for some other reason, and then in the process you sort of...
I think that probably most therapists will report in general over all disorders that there is something that's really troubling a person, that right then they're feeling so lousy that they've got to do something about it.
Okay.
That, and here with depression, you're not going to get the others complaining about it, like in alcoholism, where you know, it's the spouse or something that may be saying, God, he's driving me crazy or something. Here the person's going to say, I'm feeling so lousy and I don't know why, and they may well not have a theory. If they're particularly depressed, their ability to concentrate may well be compromised, and to focus on what's going on and to really think about what's happening to them may not really be, they're not going to be at their sharpest in all likelihood. And so this is one of those things where you as the clinician need to really examine the factors, try to figure out what's going on. Is this a stressor to something like a death in the family? Is it a result of a job loss? Is it a chronic cyclical depression that isn't seasonal, or is it one that is seasonal? What exactly is going on? Bipolar?
Yeah, you know what strikes me though more is that at some level family members might actually be a good source of information, in the sense that sometimes I know that there's been things about me that I'm not as clear about. And maybe because I've been depressed, or because, so sometimes it helps to actually ask maybe a long-time family member, have you ever noticed this about me? Or have you ever noticed any particular pattern in the way I do things? That sometimes getting that outside perspective, I think, would be quite helpful.
Absolutely. When it's possible, I like to have family members come in. I tend to come from a systems approach in any case, where you want to know what's going on in the whole world, of the person's whole world. But I think it's really helpful, because neither you nor me nor anyone else is capable of seeing ourselves from the outside the way others do. And to get that additional information from what we call collaterals, from important others in the person's life, can make a whole lot of difference, because the person just may not be picking up on some of the patterns, some of the mood swings. People don't know how irritable they are.
Isn't that amazing, how people can be so incredibly crabby, but inside of you that's so normal. You know, it's like, well, of course you're crabby.
Yeah.
That it actually does sometimes take somebody outside you to say, you know, you've really had a mood shift. I know the man who first discovered or coined, or however you want to use this term, back in the 70s, worked for the Department of Mental Health, and one of the things he noticed was his own ability to produce. And he was getting feedback that during the winter months he'd be, you know, less cooperative and less sharp, and then for some reason in the spring and the summer he would do his best work. And I believe, if I recall this correctly, part of the reason he discovered this was people outside of him noticing it as well.
Yeah.
You know, because I think when something's part of our system, particularly a cycle, at some level we sometimes maybe accept things about us even when it's negative and don't realize it can change. So, you know, one of the wonderful things about you being with us tonight is that as we close, people can know that, in fact, this isn't something you just have to live with. It doesn't have to be something, this is just the way I am. I'm depressed every single winter, but maybe there is something that they can do about it.
There really are effective treatments out there, and you really do want to explore them.
Yeah. Thank you so much for coming, Ed. I appreciate it.
It's good to see you again.
And thank you for tuning in. Join us next week as we learn about women and money and internet addiction. I'm Mary Crocker Cook. Good night.
For topic suggestions, write to Bay Area Psychology at 1723 Hamilton Avenue, Suite A,